Welcome back to the deep dive.
Great to be here.
So today we're tackling a pretty specific topic in veterinary medicine. We've really dug into a lot of sources about a condition called paraproteinemia in animals.
Yeah, it definitely sounds technical, doesn't it? Paraproteinemia.
It does.
But, you can think of it almost like a medical mystery we're trying to solve here.
Okay.
Our goal really in this deep dive is to take all this detailed info and unpack it. What is this thing? Why is it often so tricky? Because its effects are everywhere. And how do vets actually figure it out and manage it?
Exactly. We want to get past just the jargon, the technical terms, and really pull out what matters, how this one seemingly simple issue, an abnormal protein, can just cause so much chaos in an animal's body.
It's actually quite surprising when you dive into the material how a problem, starting from just one type of cell, can have such dramatic and varied impacts across so many different systems.
Okay, so let's start right there then. Based on the info we've got, what are we actually talking about? What is paraproteinemia?
Right. So at its most basic level, it means there's an abnormal protein circulating in the bloodstream.
Okay.
And this protein, sometimes it's called a paraprotein or an M component.
Yeah.
It isn't just any old protein. It's specifically made by a single type, a kind of clone of cells that have, well, gone a bit rogue.
And these aren't just random proteins, are they? The sources seem to point out they're usually a specific kind of immune protein, like an antibody molecule, or sometimes maybe just pieces of it, light chains or heavy chains.
Precisely. Yeah, that's spot on.
Yeah.
And where do these rogue cells typically come from? Well, the material suggests it's most often linked to cancers involving plasma cells.
The antibody factories.
Exactly, the cells that normally make antibodies, so things like multiple myeloma. But it can also pop up with other immune system B-cell problems, like certain leukemias or lymphomas.
So the root cause is often a specific cancer or something related, where one line of these antibody-producing cells just starts churning out this faulty protein instead of the normal ones.
That's the gist of it.
Hmm.
And what's really interesting and kind of key here is that while the underlying cancer might cause some problems itself,
Hmm.
it's often the abnormal protein itself, especially when there's a lot of it, that causes this whole separate suite of issues.
Ah, okay, and that's where all those widespread effects start showing up. The source material really lays out how this one protein can just wreak havoc everywhere. Where does that domino effect usually begin?
Well, one of the probably the most dramatic consequences is something called hyperviscosity syndrome, HVS.
Hyperviscosity.
Yeah, and it's pretty much what it sounds like. The sheer volume of this extra protein in the blood makes it physically thick,
Mm.
like syrup instead of water.
Okay, wow. Thick blood. I can immediately see how that would be a problem. I mean, it's got to be harder for the heart to pump, right? Harder for blood to squeeze into tiny little vessels.
Exactly. Yeah, just picture trying to push syrup through really thin tubes. It's tough. This slow, sluggish blood flow means tissues just aren't getting enough oxygen, enough nutrients. And the info shows this thick blood really hits several systems hard.
It's like the brain, I'd imagine, needs constant blood flow. The sources mention neurologic signs.
Oh, absolutely. Yeah. If the brain isn't getting the blood supply it needs because of HVS, you can definitely see things like uh, disorientation, weakness, sometimes even seizures. It's almost like a subtle, ongoing oxygen deprivation affecting how the brain works.
And the eyes, too. They've got those really tiny, delicate blood vessels.
You do. Very susceptible.
Yeah.
HVS can cause the retinal blood vessels to get all swollen and twisted. Sometimes they even bleed, or you can get retinal detachment.
Which could cause sudden blindness.
Yes, potentially sudden blindness. It's serious.
Wow. And the heart. Pumping thick blood sounds like really hard work.
It is. It puts a huge strain on the heart, having to push that viscous blood around. This can lead to, rapid heart rate, and over time, the heart muscle itself can actually thicken. The sources do note that cardiac failure is definitely a worry, especially in cats.
So HVS, it hits the brain, eyes, heart, just by sort of gumming up the works with thick blood. But the sources also talk about issues caused more directly by the underlying cells, or maybe other effects of the protein. What else are we looking at?
Right, good point. So if the underlying issue is something like multiple myeloma, those cancerous plasma cells can actually invade bone and dissolve it. It's a process called bone lysis.
Dissolving bone, that sounds incredibly painful.
It is, yeah. It can cause significant lameness, obviously pain, and even make bones more likely to fracture. And if it happens in the spine, those dissolving vertebrae can actually press on the spinal cord.
Oh, leading to nerve problems.
Exactly. Neurologic issues in the back legs, kind of like a slipped disc,
Mm.
but caused by the bone itself becoming unstable.
And what about the blood itself? I mean, beyond just the thickness problem.
Well, the sources highlight that those cancerous cells can essentially crowd out the normal cells in the bone marrow. It's called myelophysis,
Crowding out the good stuff.
pretty much.
Yeah.
And bone marrow is where you make red blood cells, white blood cells, platelets. So if it gets crowded, the animal can become anemic. Low red cells, leukopenic, low white cells, and thrombocytopenic, low platelets.
Okay, low platelets. That means bleeding problems.
Precisely. Platelets are vital for clotting.
Hmm.
So low numbers can cause issues like nosebleeds, easy bruising, maybe blood in the urine, and sometimes the paraprotein itself can actually interfere with how the platelets function, even if the numbers aren't critically low.
So double trouble for clotting?
Kind of.
And the low white blood cells, that makes them more prone to infections.
Yes, that's another layer of risk. Plus, there's another factor. Because the body's so busy making this one useless abnormal protein, it often ends up producing fewer normal functional antibodies,
Ah.
so that further compromises their ability to fight off infections.
It's like their whole immune system is distracted, just making garbage proteins instead of the useful ones they actually need.
That's a pretty good analogy, yeah.
You also mentioned kidneys earlier. How do they get involved?
Yes, the kidneys. They're quite vulnerable, actually. There are a few ways they can get hit.
Okay.
The thick blood from HVS can reduce their oxygen supply, which isn't good. High calcium levels, which you sometimes see with the bone lysis from cancers like myeloma, that calcium can be toxic to the kidneys.
Right.
And maybe most critically, those light chains, the little pieces of the paraprotein we mentioned,
Yeah.
they can actually clog up and damage the tiny filtering units, the tubules in the kidneys.
That's the Benz-Jones protein you hear about sometimes, those little fragments gumming up the kidney filter.
Exactly, those light chains. They can lead to protein leaking into the urine and eventually kidney damage or even kidney failure, which often shows up as, drinking and urinating a lot more.
So when you look at this whole picture, bone pain, bleeding, risk of infection, seizures, blindness, heart problems, kidney failure, I mean, it's just this incredibly wide range of signs that don't immediately scream connected. It must make getting a diagnosis really challenging.
Oh, it absolutely does. It takes some real diagnostic detective work. Because the signs are so varied, often the first step is just ruling out more common things that could cause those specific symptoms. The sources give us quite a long list of possibilities.
I can see why. You might initially think it's just arthritis, or maybe a primary bleeding disorder, or kidney disease on its own, or some neurological issue, depending on what the animal presents with, most obviously.
Exactly. And importantly, when vets see high protein on initial blood tests, they need to figure out, is this that specific monoclonal spike, from one rogue cell type? Or is it a polyclonal increase, which just means a general rise from widespread inflammation or infection?
Because the approach is totally different.
Completely different for diagnosis and treatment, yeah.
And the sources also mention, interestingly, that some infectious diseases can actually trigger this monoclonal type of protein increase too. Things like certain tick-borne diseases, or maybe FIP in cats.
They do, which is fascinating, isn't it? It means the whole diagnostic trail isn't just about hunting for cancer. You also have to consider these specific infections that somehow provoke the immune system into making these abnormal proteins.
Okay, so after the initial blood work, what are the really key tests to actually pinpoint paraproteinemia?
Well, the gold standard test to identify that abnormal protein pattern is something called serum protein electrophoresis.
Electrophoresis. Okay.
Yeah, think of it like getting a protein fingerprint from the blood. It clearly shows if there's one single tall, narrow spike of one protein type that's monoclonal, suggesting paraproteinemia, or if it's a broader, maybe multiple peak increase that's polyclonal, pointing more towards general inflammation.
And you might need special tests for the urine too, right? For those Benz-Jones proteins, the light chains.
Yes, exactly. Those light chains in the urine, the Benz-Jones proteins, they can be tricky. They often don't show up on a routine urinalysis dipstick. So you often need specific assays or even electrophoresis performed on the urine itself to find them.
Okay. And then the next big step is finding the underlying cause, right? Where are those rogue cells actually coming from?
That's the crucial next piece of the puzzle. And that's where imaging often comes in things like x-rays. especially if there are signs of bone pain or lameness. You're looking for those telltale areas of bone lysis, those dissolved spots.
Like a full skeletal survey, maybe?
Sometimes, yeah, a skeletal survey to see how widespread it might be. And imaging of the chest and abdomen, like X-rays or ultrasound, can look for things like enlarged lymph nodes or organs, which might suggest lymphoma or other problems.
But the really definitive test, especially to confirm something like multiple myeloma, is looking right at the source, the cell factory, the bone marrow.
Precisely. Yeah, a bone marrow aspirate or biopsy is often absolutely critical. You're looking for an abnormal increase, specifically in plasma cells. The sources actually give percentage cutoffs that are highly suggestive of myeloma. It also helps see if the marrow is just generally crowded out by other abnormal cells, like in leukemia.
And I suppose you might also sample any enlarged lymph nodes or other organs if they look suspicious on the imaging.
Oh, definitely. Yeah, it's taking samples, aspirates, or biopsies from those areas and looking at the cells under microscope can help confirm if the underlying issue is, say, a lymphoma, or maybe even identify an infectious agent in some cases. It's all part of narrowing down that big list of potential causes.
It really sounds like a careful process of elimination and then really targeted investigation to nail down that root cause.
It absolutely is. And once you have that specific underlying cause identified,
Yeah.
then the focus shifts towards management.
Right. And based on what we read, that seems to involve sort of two main strategies.
Yet, generally two prongs. First, and often most immediately, is supportive care. You have to manage the urgent, sometimes life-threatening effects of the paraprotein itself.
Like the HVS.
Exactly. Addressing the hyperviscosity syndrome, maybe with fluid therapy or even plasmapheresis in extreme cases, controlling any bleeding issues, managing pain from those bone lesions, supporting kidney function if it's compromised.
So treat the symptoms first, basically, while you gear up to treat the cause.
You got it. And then the second prong is treating that underlying cause you identified. So if it's a cancer like multiple myeloma or lymphoma, chemotherapy is usually the main approach. If it turns out to be one of those specific infections we talked about, then you'd use the appropriate antibiotics or other anti-infective drugs.
The sources didn't really dive into specific chemo drug names or protocol.
No, and that makes sense, really, because the specific drugs and plan would depend entirely on the exact type of cancer diagnosed, the stage, the animal's overall health.
Yeah.
It becomes very tailored at that point.
Right.
But follow-up often involves rechecking that protein electrophoresis we mentioned. Watching that abnormal M spike if it starts going down, that's usually a good sign the treatment is having an effect.
This has been, well, quite the deep dive into a really complex area, hasn't it? We started with just one little abnormal protein.
And ended up seeing how it can just ripple outwards, affecting bone, blood, the brain, eyes, heart, kidneys. I mean, pretty much every system you can think of.
It really underscores how interconnected everything is inside the body and how one, seemingly very specific malfunction can cascade into such diverse and pretty dramatic signs.
Yeah, and understanding this pathway, I think, helps you appreciate the incredible diagnostic detective work that veterinarians have to do sometimes, piecing together clues that might seem totally unrelated at first glance to find that single underlying thread.
Absolutely. So as we kind of wrap up this deep dive, here's maybe something interesting to chew on based on everything we've discussed today. We saw that this production of a single abnormal protein clone, this paraprotein, can be triggered by certain specific cancers, right, like myeloma, and by certain specific infectious diseases.
Yeah, that was fascinating.
So what does that actually tell us about the incredibly intricate and maybe sometimes really surprising ways the immune system can malfunction or even be hijacked, leading it down these really unusual paths? This whole deep dive into paraproteinemia, for me anyway, is just a vivid reminder of how truly complex and interconnected the body systems really are.